Medical providers can have fear about referring people to palliative care because they fear loss of control. They fear that maybe patients will lose hope.
People don't want to be labeled as a palliative care patient or a patient that's that sick that they need that level of service. Instead, what's helpful is to know if patients have needs that could be served by a team that consists of a comprehensive approach, a doctor, a nurse, a social worker, and a chaplain, and that team can help that patient and family's journey be better.
So that's asking, what are your goals? Who are you as a person? What is acceptable to you, and what would be a situation that you would find abhorrent, that you would never want to see yourself in?
So we filled this form out so that you can be protected when you get home.
Living with serious illness can be very busy, especially in large medical systems. There's a lot of people involved in care, and one of the ways that we can be useful is that we communicate frequent and often with patients and their families about what goals and values they have, as well as to referring providers and all the specialty people that are involved in caring for that patient.
As a palliative care physician, I am here to work with other physicians as part of my team as well, other care providers, and to see what's their best assessment, what do they think their patient needs, and to help them get that.
To really make sure that the provider also has the support he or she needs to tend to some of the psychological and social emotional components of the patient and families as they're suffering illness.
My goal as a palliative care physician is to alleviate unnecessary suffering. If I don't meet a patient till near the end of their life, then I've missed a lot of time I could have helped improve their quality of life.
Now let your family know.
Okay.
So that then they can, according to your wishes, say, we don't want this.
Okay.
I would say to other doctors not to be afraid of your palliative care subspecialists. We're not here to hasten end of life. I'm here to help people live the best life possible for as long as possible.
So the benefit of referring patients to palliative care, if you're a hospitalist or an intensivist in the medical center, is that you're providing an extra layer of support to your patients and your family members, that you're creating space to allow for time for difficult conversations, that you're creating a space to better understand your patients' hopes and wishes.
And it may benefit the providers just as much or more in some cases as the patients themselves. So I would like to tell PCPs and primary care providers that we can help them by being able to take the time to have more in-depth conversations that they may actually really like to have, but they can't fit into their really busy practices in the time frames that they're allotted to meet with people. So that's one way that we can work as a team, because that information that I can elicit from those conversations with patients and their families can then be shared with primary care providers and other types of outpatient clinicians to help them provide a more person-centric and comprehensive type of care without having to do it all themselves.